Now, the vaccination of teachers kicked off this morning around the country. 300,000 Johnson & Johnson doses have been earmarked for those who are employed in the education sector. For more on what this means for the sector, I'm joined by Elizabeth Biney, who is a researcher at Equal Education. Ms. Biney, good to have you with us this afternoon. Now, yourself, as well as Satu, have been very supportive of this vaccination drive for teachers. Tell us why you think that this will have a positive impact on the sector at large.
Obviously, vaccination is not an end result. It's not going to be the silver bullet that cures the pandemic. But we believe that the vaccination process will help reduce the risk to teachers and educators around the country, which will then help the sector to open up schooling full-time for primary school learners, which will help us to recover some of the learning losses that we had in the previous year, and hopefully that will help to also recover the education system somewhat, because we've seen that the pandemic is having a really grave effect on teaching and learning, and learners in disadvantaged communities are adversely impacted by the extended closures or lockdown, so to speak. So the vaccine is a good call in the right direction for us to obviously protect our educators and our education staff, at the same time helping to also recover some of the learning losses that we have experienced in the previous year.
You've highlighted the importance that vaccination will have on trying to complete the curriculum. But talk to us about the drop-up rate that was experienced during the lockdown.
So the pandemic has had an impact on learners' ability to be retained in the education system. Obviously, we don't have the DBE and us, or researchers in general, don't have a concrete way to really quantify the impact of the pandemic, or even quantify dropout rate, as it is a moving phenomena. But we believe that significant losses or significant dropout happened during the pandemic because of the on and off impact or closures. So when learners rotate, days that they are not home, they might not, be following up on the learning at home as they would have done full-time at school. And this is really important or serious for learners who are already sort of experiencing hardship keeping up with the curriculum normally. And with the pandemic having reduced the amount of learning time, you will see that struggling students who are now going on and off or having that rotational timetable will feel extra burden or anxiety around catching up, and these learners are less likely to return to school if they have been out of school for a prolonged period of time. So it does have a significant impact on dropout rates, but we cannot for sure say that X amount of learners dropped out, because every estimate that we'll give will either be an overestimation or really conservative estimate. We haven't really been able to really quantify that dropout rate, but we know for sure from research that it is having an impact on learner retention, and it is exacerbating an already phenomena, the dropout rates that was there pre-COVID and now during COVID pandemic.
And how have teachers received this call for vaccination? Are there certain quarters that are perhaps reluctant and not too keen to be inoculated?
There are two schools of thought here. There's a group that are really welcoming and accepting of the DBE's move to have this rollout for educators, and obviously seeing educators as equally important as the healthcare workers or frontline workers. But then we must also not rule out the group of people who are vaccine hesitant or who will need a little bit more convincing, because there are lots of misinformation out there, and there's also anxiety around a lot of issues. So we need to bring in this other group of people into the fold slowly, but on the whole, educators are welcoming or sort of happy with the decision to have them vaccinated or help reduce their risk to COVID infections a lot more than people who are reluctant to have it.
The department aims to vaccinate around 500,000 teachers by the 8th of July. And there are certain areas that have been pinpointed vaccination sites for this. Looking at the infrastructure and the plans that have been put in place, is this an attainable goal?
Well, just off the bat, we are quick to sort of criticize the government in terms of delivery or processes, but this is too early for us to call on the matter, right? We cannot say that they're going to fail or they're going to succeed. We just have to monitor the process and see how far it goes. But I believe that if it is done according to the strategy that the health department has helped put in place, and if the will is there and the commitment is there, it is doable. Whether or not it meets that target, we cannot say for sure, but if they're doing all they can to help start the process and to complete it as soon as possible. But just on that matter as well, vaccination is not the only solution to the problem. We still have to look at it holistically in terms of the infrastructure at schools that promote safety, learning, and teaching. So the government, beyond the vaccination being rolled out in this period of time, the department also needs to take time to make sure that the COVID essentials are in place, the PPEs, the sanitizers, the school infrastructure is intact so that learners return to a more safe and well-structured reopening when they come full time.
I wonder if you may have access to this information, but let me ask you nonetheless, do you know the number of teachers who actually have registered for vaccination, or at least the percentage of those who have registered?
No, I cannot give you a figure off the bat, but from our understanding from the DBE's sort of media statement or report, the teachers that are in their system will automatically transfer to the registration system for vaccinations, except for those who were not formally registered or on their official system. So we don't have access to that information. Access to certain those kind of information is part of the battle that we fight on a daily basis. Certain vital information that will help us monitor the progress of important school events or infrastructure issues are not readily available to the public. So information like that, we have to really search and nag the department for it, or even sometimes resort to higher requests for this kind of information. So I'm not at liberty to tell you exactly what you need to hear, but they have a system that easily transfers the kind of database they have for the education department to the Department of Health to be able to know how many teachers they need to roll the vaccines out to.
Ms. Biney, thank you for your time this afternoon. That's Elizabeth Biney. She is a researcher at Equal Education.